So that's nice. Right there. I want you to bring that right up here, because then good. That is, I did a capital flexion and followed by the cervical flexion. That's combined. That's not cervical flexion. Right, so I'm doing the wrong thing first, try to do the right thing. So you get, if you ask the patient to touch right here, you did already capital flexion, right? And then you followed by cervical flexion. But for the cervical flexion only, I want you to remember that when we got that hit up, and we will follow my hand and do that. Follow my hand. Keep going. Okay, so that's the cervical flexion. Cervical flexion is straight up to the ceiling. You raise your hip straight up to the ceiling. Right there, up, right there, and go down. That's grade 3 against gravity. Good. That's good. According to Dr. White, that's grade 3. He's able to go against gravity through the full range without resistance and hold it. And I will do that again up here. And my resistance will be right there. Hold. Okay. She's like, it's not taking that much resistance. Actually. And lift it up again. And do more. Oh, she's not holding it. So she's not really grade 5. And many of you will find that flexors are weak. Find the extensors are good, but the flexors is weak. So that so many people have flexors. All right. So I will give her grade 4 for the neck flexors, and then I will try to get again the grades. Are you concentrating now? The grades for less than that. I'm going to change all what we just keep teaching you this morning for the grades. So I know the flexors of the neck are mainly the SCM muscle, right? Sternocleidomastoid muscle, you bend both of them together, you get that flexion, right? So I will isolate that. If it's not able to do that together, I will ask her to turn to this side, good, come down, turn to this side, and that will be grade 2. Grade 2 is able to rotate using one muscle at a time. So if she rotates to the right, she is using the left sternocleidomastoid, and if she's rotating to the left, she is using the right. So right there, you can feel it right here, working, right? So I test that individually, one side at a time, and that's grade 2. She is able to rotate her head to the right, able to rotate her head to the left, right? And that would be grade 2. Grade 1, I'm going to palpate. So ask her to rotate and palpate the opposite, the SCM on the opposite side. See if she's producing any movement or not, or any contraction or not. Again, to the other side. Right? If there is a contraction, that's grade 1. If there's no, that's grade 0. So what was the difference here on that cervical flexion is you tested grade 3, go with it. Grade 3, all right, grade 3, and then grade 4 with resistance right on that forehead. Right? I usually, when I do that, I usually support the head as well. So I support the head whole because she's already weak, so I need to support the head. So if I'm not supporting the head, you may whoop, get that. We don't need to, sorry. Right? We don't need to do that to our patients, right? So support the head while you're going down. You do moderate resistance, and then you do the maximum resistance when you get to the end. When I go to 2, if she's not able to do that, there's no way to test that except individually. So I will individualize the muscle, do that, the SCM by itself at one side, and this is rotation to the right. I'm testing this one right here. Rotation to the left, I'm testing the right SCM, right rotation. And that will be grade 2. Grade 1 is trying to go to rotate to the right, is trying to, and I feel some muscle contraction. That's a good one. Trying to feel some muscle contraction, but not able to. And you'll find that patients with the cervical fracture of the atlas, and they put them on brace for 5 weeks or so, and then they come to you, they take that off, and you try to examine the muscles, and they'll find not able to get all that. That's a reality, that you will find people not able to rotate at all, but they don't have the muscles. All right, that's the turn. And I feel the SCM right there. Do you remember that? Do that. So feel the SCM. You can feel it on yourself. Which one there? Good.